Before we begin, we'd like to give special thanks to all of our sponsors for helping make this event possible each year. Specifically, thank you to CRL FormFox for being our title sponsor for 4 consecutive years. And thank you to our platinum sponsors, OraSure Technologies, Psychmedics, Quest Diagnostics, and Samba Safety.
Hello, and thank you so much for joining us for our last session of this conference. Today, we're joined again by Colin Woods, General Manager of the Industrial Division at DISA Global Solutions. Colin, how you doing?
Man, I'm doing good. Great job to you and the team on a fabulous day with DISA. Thank you to our sponsors and all of the attendees.
Yeah, well, hey, thank you so much for coming back to present a second time. Today, we're going to talk about One DISA, basically the DISA ecosystem of products. Before we dive into that, we do want to just give a little bit of housekeeping. If you have questions about these product services, some of the information Colin's going to go over, drop it in the Q&A section at the bottom right. If we're unable to get to it today at the end of this session, we'll touch base with you again after the conference. Additionally, we're going to make a copy of this presentation available in PDF in the materials section at the bottom right. So at the end of the conference, at the end of this session, it'll be the end of the conference, you'll be able to download that. With that being said, Colin, take it away.
Thanks, Thomas. Like Thomas said, this presentation is really focused on the overview of all of DISA's services. My name is Colin Woods, and I'm the General Manager of Industrials. I've had the fortunate opportunity to work very closely with our clients and the industry since joining DISA back in 2002. And I've seen an evolution with regards to drug testing trends, science, technology across a suite of our services. And so today I want to walk you through the evolution of that and really go into some detail on some specific products and functionality that we've got, again, across the enterprise. So who is DISA? Well, DISA was founded back in 1986. We have the first and largest contractor consortium program anywhere in the world. And I'll touch on this a little bit later, but this is really focused on contractor management. We have over 40,000 client companies, and 27% of the Fortune 500 use DISA for some of our services. We've got well over 4 million employee records that we're managing on a daily basis, and more than 6 million different customer products served annually. We've got, really 2.5 dozen offices across the US and Canada. And since 2017, by an independent industry survey, DISA has been ranked the #1 TPA, third-party administrator brand, again, across the industry. Our focus is on compliance, and compliance requires really 2 things: accuracy and speed. And so we are leveraging our IT systems, our compliant policies, as well as hundreds of years of experience across the industry on our leadership team. And I know we don't look that old, but it is amazing how many years people have been working in this industry, helping to set best practices and build programs really focused on safety and security and compliance for the workforce. So to start out, I want to talk about our 2 largest services. Our first service that we created back in 1986 was the drug and alcohol testing program. And really, this has a number of different components to it, but it boils down to the fact that DISA is managing the entire chain of custody, which I will talk about in a few slides. We're ensuring that we can comply for corporate programs, Department of Transportation programs, as well as that contractor management, that consortium concept that I mentioned earlier. This drug testing program covers all types of purposes for tests, as well as test methodologies, such as urinalysis, oral fluid, and hair. We also are performing hundreds of thousands of breath alcohol tests annually for a number of our clients. With regards to leveraging technology, something that has really emerged over the last decade, and it's very exciting for everyone involved, is the electronic ordering capabilities. In the industry, we refer to this as ECCF, electronic custody and control form. And what this allows is the client to place an order for a drug test, have that information, kind of like a boarding pass for a plane, sent to that employee or applicant, and then the employee and applicant, again, can take that electronic boarding pass into a facility to perform the necessary testing. This improves turnaround time, accuracy, and it definitely reduces administrative burden for all parties involved. Now, our second largest service line, which really came to be in 2002, 2003, is background screening. And I'll go into a little bit more detail, but there are a number of products associated with a background check. So I always get a kick out of somebody who says, yeah, we require a background check, or yeah, what's it cost to do a background check? You know, the reality is there are so many different, combinations of products that can be put together depending on the job function of that employee and applicant. Whether it's a truck driver, whether it's somebody working in your finance department or going on site for a client. And so, what we're doing is we're working with our clients to identify the appropriate products fit into the right packages. And this creates standardization across the client. So all hiring managers are ordering the same thing. We also have grading and evaluation, which is really taking all that data that's coming in from these various background screening sources and turning it into information. But more importantly, providing an answer to the client saying whether or not these reports meet the standards and comply with the policies of that client. We also have electronic capabilities like applicant order entry, very similar to ECCF with drug testing. This is where the client can initiate a background check order, send that link electronically to the applicant or employee, and then that individual can complete the required information, consent, and signatures all online. You can see some of the products that we've included. Again, we've got 24 different products, but they really are falling into, criminal checks, verifications, the ability to comply with a policy, ultimately either getting hired on or going to a job site. Now, this next slide's really looking at additional services that we've developed more recently over the years. And again, more recently means over the last 10 to 12 years in some cases. But transportation compliance is an exciting one. Transportation, oftentimes people are thinking of the trucking industry, which is absolutely the largest DOT regulated agency across the country. However, transportation compliance with regards to DISA, it's focused on all modalities. Again, planes, trains, automobiles, the focus is on all of the DOT agencies as well as non-DOT agencies where there is an operation of a vehicle. So some of the products that fall under this umbrella include motor vehicle reports, the SIDLIS reports, DOT previous employer checks, and really all of these are encompassed into what we refer to as the driver qualification file. And the driver qualification file is a Department of Transportation requirement. It's something where an employer has to have this file with several different components in it. And now the beauty is several of these components are products that DISA offers. So when a client is leveraging DISA to manage their driver qualification file, they can also have additional products like the motor vehicle check, like the drug test or the DOT driver physical, auto-populate into that file to ensure compliance. Next up is our occupational health screening. And really this kind of has two sides to it. The first side is working with 24 different facilities across the country. These facilities are DISA owned and they are providing a variety of products, including things like physicals, respiratory fit testing, audiometric testing for hearing. And again, consider these screens fitness for duty. Now we also have several thousand site network of third-party vendor partners where they are supplying similar screens and they're coordinating with DISA and the DISA systems to ensure that the client's ordering is consistent, but also that information, once the screen is completed on the individual worker, it's communicated back to the DISA systems, and the client has access to that. And then finally, I'll call it training and compliance, but really this is focused on HR related, industry related drug and alcohol policies for training, but also that policy review, audit, and potentially even policy creation if you're either new as an employer, or maybe you found yourself in a new situation with regards to the ever-changing legal landscape of state laws. So I've always kind of broken our programs into three buckets. The first one, and this is where we started in 1986, is with corporate policies. This is the employer's choice. What is the who, what, when, where, and why of their policies? The next one is DOT, or Department of Transportation. These are federally regulated policies. So the federal government is telling you what you have to do, when you have to do it. And so this one's very specific, heavily regulated, and highly audited. And then the last one is that contractor management. We call it the DISA Contractor Consortium. And this is where the company has a client that has specific requirements. And so in each of these buckets, all of those services that I just outlined can apply. Corporate programs choose to do a drug test or a background check. Department of Transportation absolutely has regulations that state you must do drug testing, background checks, all the transportation compliance solutions, occupational medical screens and training. And then contractor compliance programs, again, focused on that site access, are absolutely putting together programs that are specifying what drugs to test for and how frequently. What are the background check products that go into that package, and how do we grade them? So again, all of this leads up to that primary focus of compliance. And the reason for compliance is because you have auditing agencies, regulatory bodies, client requirements, but honestly, complying with these various policies and programs, really, it's focused on risk mitigation. It's enhancing the safety and security of that workplace. This is just a snapshot of the evolution of DISA. Again, 86 we were founded, and 1992 was that DISA Contractor Consortium. You fast forward into the 2000s, and we have new web-based online systems for our clients and vendors to navigate with. There are various industry programs that were launched. And then we started to add new methodologies for drug testing, just as an example, where the science has evolved and there's different ways to test for those drug metabolites, whether it's hair testing or oral fluid testing. There was a broad expansion in 2013 with transportation compliance services, and we've reignited that over the last few years with significantly more systems and that leadership expertise. And then most recently, we have developed an applicant tracking system, ATS, called DISA Hire. And this is really focused on that recruiting and onboarding. And then it ties into all of those pre-employment screens, as well as the recurring screens that are required as an employer. And then unfortunately, with regards to COVID, a number of companies have had to scramble, whether it was COVID testing or now vaccination tracking. So that is another solution that we've lumped in there to assist clients with some of the challenges of just tracking their employees and ensuring a safe work site. So the next several sections are really going to just spend a little bit more time on each of those service lines. So the first one is drug and alcohol testing. The program types, like I mentioned, you got the Department of Transportation. You know, these agencies started putting out regulations in 1989. And again, it specified what are the requirements of an effective drug testing program. Corporate testing, although it's been around longer, oftentimes leverages some of those regulations, a little copy and paste, to make sure that they are in lockstep with the federal regulations. And then the DISA Contractor Consortium, you know, we've seen that grow and evolve over the years with different drug types, different methodologies. And so that's all really responding to trends in the industry, whether it's challenges at owner work sites or new drugs of abuse. We want to make sure that we're keeping the science up to date for the clients, again, to promote that safety. All of these methodologies are available. So urinalysis testing is the gold standard, pun intended, I guess. You also have hair testing, oral fluid testing, and that breath alcohol testing, which again, hundreds of thousands of breath alcohol tests are conducted annually. And this is heavily focused on the consortium as well as complying with certain DOT agencies. All of the various tests are available, again, from starting with that pre-employment test, really through the life of that employee and their employer relationship. One thing I would call out is with regards to reasonable suspicion testing. So this is something that unfortunately, there's not a lot of confidence from an employer perspective when conducting reasonable suspicion tests. And it really comes down to training those supervisors, training those managers as to what the policy entails, what are their rights as a supervisor if they do believe there are signs of abuse and impairment, and what steps they can take. Fortunately, 9 out of 10 times, that test comes back negative, but it's not the wrong thing to do. The 1 out of 10 times, that's really that detection. So you want to make sure your folks are up to speed on the policy and have that confidence via training. All of these services are really available electronically. So they're on the DISA systems, but you can coordinate through DISA to identify what the next steps are, ordering tests, selecting randoms, and really making sure your employees are in compliance and getting those renewals. We are managing the entire chain of custody process. And again, this is complex. Kudos to the marketing folks. They've made the slide look simple, but bottom line, there are a lot of moving parts. There's a lot of regulation and focus on accuracy and quality. With that said, we've got to make sure we're working through this chain of custody process very quickly in order to ensure we're getting that employee hired, we're getting that employee back on the job site. And so when you think about it, it starts with the client. The client's going to initiate that testing by communicating to the employee or the applicant. At that point, the employee or applicant will be going to what we refer to as a collection site. And there are several thousand of these sites across the country that are focused on the drug and alcohol collection. Once the specimen is collected and the paperwork is all completed, that is shipped off to a laboratory. And these laboratories are focused on identifying whether or not that drug metabolite is present. If they find that drug metabolite, they're going to communicate their findings to the MRO, the medical review officer. I personally think this is the most important part of the chain of custody process, because the MRO's job is to identify whether or not that drug metabolite is there legitimately or illicitly. And I'll give you an example. A number of people have opioid prescriptions legitimately, hydrocodone, whether it's for a surgery or pain, and they're taking it per doctor's orders. So in the MRO process, the lab has identified that that opioid is present. The MRO does a donor interview and identifies through a number of different steps that the individual has not violated the illicit substance abuse policy because of that prescription, because of the doctor's orders. Flip side is most people don't have a prescription for cocaine. And so when the laboratory identifies that and communicates it to the MRO, they're going to have a different conversation with the donor interview and ultimately report that test out as positive. Now, there's follow-up steps beyond the reporting of that positive test. The SAP, Substance Abuse Professional, and RTD, Return to Duty Department, these are groups that are going to work with that individual worker to ensure they're getting the necessary treatment, education, rehab, and follow-up testing, ultimately getting them back in the workforce in a compliant manner. Now, the next section, we're going to focus on background screening, some of the functionality and programs. So all of these services are available online. So again, kind of like ordering a pizza, clients have the ability to go online and order either specific products or, in most cases, packages, which are just groupings of products for certain reasons. It's typically based on the type of job function that worker is performing. We have the grading and evaluation that I've talked about. Again, identifying whether or not the data coming back in those background check reports complies with the policy that that client or the industry has set forth. All of these programs are really regulated by FCRA, which is the Fair Credit Reporting Act. And so we want to make sure we're providing that assistance, providing that guidance and direction to clients to ensure they're doing the right thing and they're staying in compliance. We also have a lot of technology wrapped around ensuring everyone is doing the right thing. So another key component I would say would be, automatic renewal notices. So one of the biggest challenges, again, whether it's corporate, DOT, or the contractor management program, there are recurring requirements. I need to run this product annually. I need to run these products every 2 years. And so one of the things DISA is focused on is providing those reports, providing those reminders to ensure that the client knows they're coming due with an expiration on a certain product or products. And this helps assist them in making sure they always stay in compliance. This is an example of the grading and evaluating chart. You can see fairly simply 0 to 7. 0 is a clear record. And anywhere from 85 to 90% of the individuals that we're screening on an annual basis fall into this category, a clear record. But what that means is 10 to 15% of individuals have some form of record that falls into nonviolent misdemeanors all the way up to higher felonies, and in a very small set of cases, Patriot Act hits. Now, next is transportation compliance. And unlike drug testing and background checks, this is really more of a portfolio of products on its own. So we've got really 2 slides focused on this program. The first is tied to the driver. So I touched on the driver qualification file, but essentially there's a number of requirements that need to be in this file. DISA's DQ file management is electronic, and if there are certain screens or checks that need to be performed that DISA does, we can auto-populate those into the file. Again, like all of our products, those automatic expiring notices, those reminders to kind of maintain compliance, are all in effect. And a key component to the driver qualification file is the auditor access. So versus the traditional process of an auditor going into a filing cabinet and seeing all of these different files that may not be applicable for the audit, our clients are able to select the specific files applicable for that audit and give the auditor online DISA access just to those specific files. The next one is hours of service auditing or out of route reporting. Again, focused on the driver and their behaviors. Are they complying with certain drive times? Are they going from point A to point B, or are we seeing some discrepancies with regards to that route? And then finally, continuous driver monitoring. And this is something that, honestly is heavily focused on the driving performance. So think of a motor vehicle record. And this is something that most clients are running annually. But again, for 11 plus months of the year, there could be activity, there could be infractions, and the employer's not seeing those. So continuous driver monitoring allows that 12-month visibility into the driver's behavior, real-time alerts in the event that there's any negative driver activity. Now, what I can tell you is this has resulted across the program in a 22% reduction in monthly violations, 14% reduction in monthly crashes, and 32% reduction in company risk profile events. And the reality is it's a transparent real-time program. So it's allowing the client to identify bad behavior before that bad behavior gets worse. It's also a deterrent for all other participating drivers because they know there's this monitoring program and you want to drive safely. This next slide is really focused on the fleet management. So previous slides talking about the driver, this is really talking about the trucks. And you can see there's a number of different items on here that are focused on helping clients comply for their fleets, for their vehicles. First one, licensing and permitting. So when you think about the wide load placards going down the road, these are vehicles and licenses and permits that have had to be obtained in order for that vehicle to drive legally on the road. Fuel tax reporting. This one is unbelievably complex, but we've got a team and a system that make it sound easy. These are little tax returns. So when you think about a truck driver going across state lines, they're buying gas in one state, but they're using that gas while they're driving along roads in the other states. And so these fuel tax returns are essentially distributing the appropriate amount of tax dollars for the states based on the mileage they've driven in that particular state. And you can see there's a lot to do with tax recovery and refunds, again, based on the type of driver and vehicle on the road and the activity that's taking place and where it's taking place. So in these cases, clients are able to perform this service and offset some of the costs that they have for some of the other regulated requirements. So again, you can see some of the other fleet management where you think about, the registrations and renewals and the e-manifests. These are all ways to ensure, one, that fleet is in compliance before they get on the road, and two, they stay in compliance while on the road. Next is occupational health. So I mentioned that occupational health is really broken up into DISA facilities that are owned across the country, and then by a very large network of third parties that are providing these services, and then working closely with the DISA team and the DISA systems to ensure clients have that visible access. But really, OCMED is focused on making sure the protocols for the required products are communicated from DISA and the client to the facility. When John Doe goes to that facility and has those screens performed, that information is communicated back into the DISA system. So the client has that compliance, they have that transparency across their organization. And in most cases, they're also going to have renewal notices tied to a number of those products. And then we're also consolidating the billing. So you can imagine a client with 200 locations. They don't want to receive 200 bills for all of these different products. We're consolidating it into one bill. So again, very easy. We're reducing that administrative burden and really kind of heightening the standardization and transparency. This is a map that'll show some of those sites. Again, you can see a number of them on there. They're all really focused on getting those workers in so we can identify whether or not they are fit for duty. And you can see drug and alcohol collections are always a part of it. Hearing testing is a big one, pulmonary function and respiratory fit. So mask fitting for individuals going into certain facilities. And then you always have additional services like physicals, like case management. And then lastly, we've got the training, and this really kind of falls under that compliance and policy header. But the focus here is ensuring that clients are educated on the policies and requirements. And so whether that's safety training, whether that falls more under the substance abuse training and HR related training, or it dives into the policy review. And I would say with policy review, again, it's identifying, is your policy in compliant with this ever-changing legal landscape? Do you have multiple policies because you have multiple types of job functions? You've got folks in the office, you've got folks in the manufacturing plant, you've got folks going onto a client site. You may have DOT regulated employees. So managing multiple policies and ensuring they're up to date is critical. And then the audit support And I will say mock audits make a world of difference. Going in with that checklist and behaving as if it's a real audit, this will get you in line. It'll identify action items to improve your current program. And then moving forward, in the event that you truly are audited by some agency, you'll be ready for it. So, we talked about a lot of the services and honestly the evolution and introduction of these services over the years. We certainly don't want to stop. We're always focused on client feedback. If our clients have needs, have issues, we're identifying trends in the industry or the marketplace, we want to make sure we're developing functionality and programs and policy that help comply, reduce administrative burden, save time and money. And you can see all the things we've talked about. But those additional services that are out there, really include that expanded VAX tracking. This is something that we're having daily conversations on with our clients. We're all watching the news, trying to make sure we understand what are the requirements, what are the opportunities, how do I do this so I'm making sure my employees are safe, and as an employer, I'm compliant. COVID-19 test tracking, a number of folks are taking the tests, but the question is, are they being tracked? Are they visible to the people that need to see these and monitor these? And oftentimes we hear about site access and the requirement of either a vaccination or a COVID test. And in some cases, we're hearing the combination of both are required. And so this is becoming a challenge for individuals as well as companies. And then lastly, the marijuana breathalyzer. And again, with all of the emerging laws regarding marijuana legalization, it is quickly becoming apparent that there needs to be a recent usage detection. All of the drug test programs that I talked about, although some of them may identify recent usage, they all also pick up historical usage, whether historical was yesterday, last weekend, or 3 months ago. And so when you think about breath alcohol testing, that's really focused on impairment, that's really focused on recent usage. The marijuana breathalyzer technology that is really kind of emerging onto the market in 2022 commercially, that is something that employers, depending on the state, depending on your site or your circumstances, are definitely going to want to hear more about. And we'll certainly have more information, as that technology gets closer and closer to launch. I'd like to thank you all for your time, and I'll open up to any questions.
Perfect. Well, let's dive into some of the questions from the audience. Colin, should I remove marijuana from my policy?
Yeah, that's a good question. What I would have said a year ago is absolutely not. As we've seen the laws evolve and we've seen the legalization of both medical and recreational marijuana, what we've also seen is the employer's ability to maintain marijuana on their testing panel as it relates to their illicit substance abuse policy. Now, with that said, in 2021, New York and New Jersey legalized marijuana, very similar to several other states across the country, but they removed several of those employer protections. And so it's very challenging for employers in those states to continue testing for marijuana. So what I would say is one point of clarification: Department of Transportation regulated employees, these are federally regulated programs, marijuana absolutely stays on the panel, even in New York and New Jersey. Now, with regards to your corporate program, per the letter of the law, marijuana is not something you want on the panel. So you want to consult with your legal counsel to identify what the risk is for taking it off, where you absolutely could have that impairment and potentially a safety and security concern, versus leaving it on and now potentially you're running the risk of violating certain letters of the law.
Great. Colin, how long do your backgrounds typically take to complete?
Yeah, good question. Again, there are 24 different background check products. In a number of cases, these products are instant. So literally by the time your screen refreshes, the data is back. In other cases, it could take several days or weeks. And I'll give you an example. Education verification. Oftentimes when you get around the holidays, those universities and colleges are closed. And so our researchers are waiting for that office to open back up before they can retrieve the information. But what I will say is, on average, for standard packages across Department of Transportation, across manufacturing, industrial, energy, we're seeing it take approximately 2 days. And again, that's inclusive of several different products.
Colin, do you recommend using urine or hair as a primary drug testing methodology?
Yeah, good question. And that's a tough one because I hate to do this with questions, but I'm going to say both. The reality is, when you look at Department of Transportation, urinalysis is the required methodology. And when you look across a number of programs nationally that aren't regulated by the federal government, you're going to find urinalysis was kind of that incumbent methodology. There's benefits. So the reality is, you can have an expanded panel, lots of different drug types to choose from. It's hypersensitive, so it can detect very, very low levels of a drug metabolite in your system. And it's really looking at, recent usage, and that's a broad term, but call it point of usage out to approximately 1 week. Now, flip side is, when you think about hair testing, it's like a little tape recorder. And so you've got to wait a week or two for it to grow out past the scalp. But once it does, industry standard is you can measure up to 3 months of drug metabolite usage. It's not as hypersensitive, so you do need some consistency and concentration of that drug built up in the hair cortex. So honestly, what I'd recommend to employers that have the ability and the opportunity to do it, there's pros and cons of both methodology. When you put them both together, you're getting the pros of both. And the only con really is the cost, because you're doing 2 tests versus 1. So again, it's figuring out the time and the place. If you can close those gaps by doing both, certainly recommend it.
Does DISA help with FCRA requirements?
Fair Credit Reporting Act, yes, we do. And one of the things I'll say is, FCRA requirements are built in to our systems. So technically, we are sourcing information, parsing information in a compliant way. We have SOPs focused on manual processes where we have compliance folks QCing the data. But then we're also absolutely having conversations with clients about opportunities and scenarios and certain risks.
Colin, how prevalent is fentanyl? Should we be testing for it?
Yeah, fentanyl is a definitely an emerging challenge. Drug overdoses have reached an all-time high, and fentanyl is the #1 leading cause of those. It is a drug similar to morphine, so it's falling under this opioid category, but it's 50 to 100 times more potent. And the issue is, it's spreading like wildfire because it is being manufactured illegally. So you're seeing it in pill form, but even more dangerously, it is being laced with other drugs. And oftentimes that user of those illicit drugs is unaware that fentanyl is present, hence the overdoses. So it's definitely a scary drug. We're seeing usage and availability on the rise, and we're actively having conversations with laboratory partners as well as clients as to when to add this to the testing program, because it certainly is something that doesn't seem to be going away, and it's absolutely creating a lot of risk.
Colin, how easy is it to consolidate programs from other providers to a single provider?
Fairly simple. I mean, again, step one, we want to have almost a consultation. We want to identify what programs you have in place, what are your likes, your dislikes, what's on the wish list. And then at that point, we can create the program implementation, and whether that's implemented over a matter of days or weeks, depending on kind of the size and complexity of your organization and your programs. It's definitely something that adds a lot of value to the client, because you're getting a single point of contact, not just for things like invoices, but really that transparency across your employee base for a number of different programs. And like I talked about, The focus with our systems is to drive standardization, to drive compliance. And anytime you can consolidate it, that administrative burden goes way, way down.
Can you integrate with my ELD or other platforms?
We can. So when we talked about the transportation compliance, there were a number of services focused on the driver, but also focused on the fleet. And so that is another, consultation where we would want to identify what kind of programs do you have in place, what kind of technology do you have with regards to your vehicles, with your gas and fleet management. And at that point, we can definitely integrate and identify solutions that really save a lot of time, but again, drive those compliant reports.
Colin, we've recently developed need to proctor COVID tests. Can you help with that?
We can. Again, this is COVID. COVID solutions are a moving target, but that is something that we have recently piloted with a couple of our clients. It's been very helpful for workers that need to go on site, traveling out of the country, potentially back into the country. So it is something that is in the works. It technically is available and more to come.
Does DISA Hire integrate into my existing ATS and onboarding platform, or does it replace it?
DISA Hire would replace it. Now, with that said, integrations into your HR system are available, both with DISA's systems as well as the DISA Hire solution. But essentially, the DISA Hire solution is designed to be that recruiting tool and ultimately onboard the employee, where there's a direct connection between the applicant tracking system, which is DISA Hire, and the DISA solutions that are providing the drug tests and the background checks and all of that necessary reporting.
Well, Colin, I've asked you a dozen questions here. I think I'm going to take it easy on you and let you go. If we haven't answered your question, though, we will have someone reach out to you within the next couple days. Again, thank you so much to everyone for attending this session and all of the other sessions throughout Day with DISA. And Colin, any final words before we close out?
No, thank you to the marketing team, all of our presenters, sponsors, and especially all of the attendees. It is so appreciated. And yes, we'd love to hear your feedback, your questions, and continue these discussions.
Great. Thank you again to everyone. Have a great day.